I'm going to be teaching you 4 steps on how to care for a newborn baby's umbilical cord. The first thing you need to do is to wash your hand with soap and water. The water should be running water while the soap should be liquid soap. But if you are a healthcare provider, you don't need to wash your hand with soap and water. All you need to do is to wear your hand gloves. That is the first step. The second step is to take your gel, which is called chlorhexidine gel. This is what is recommended by the World Health Organization, that is WHO, as a first line for the care of your baby's umbilical cord. But there was a research that was done in the northern part of Nigeria with spirit, which shows that it also does the same work as chlorhexidine gel. So my take is that look for this chlorhexidine gel first, but if you have looked for it everywhere without getting it, you can use spirit. And some people have also said don't combine the two of them. So the second step is to get your chlorhexidine gel, then you open it. If you want to open it, just use the outer part of it, just make contact with it, then it is already open. So the second step is to get your chlorhexidine gel. Then the third step is to use your other finger to hold your umbilical cord up like this. And the third step is to apply the chlorhexidine gel at the base of the umbilical cord. Please take note, you apply it at the base, not at the tip. You apply it at the base. And after you have applied it at the base, then the first step is to use your hand to spread it up from the base of the umbilical cord. You spread it to the upper part, including the tip. Take note, when you are applying it at the base, don't allow it to touch the skin because it can irritate the skin. Again, some of you might be asking, why did I start from the base and not the tip? It is just like your wound. When you are cleaning a wound, you don't clean the surrounding skin of a wound before you go to the wound itself, because you can spread infection to it. The same thing applies to when you are cleaning umbilical cord. You apply the chlorhexidine gel at the base of the umbilical cord and make sure it doesn't touch the skin. Then use your hands to spread it to the upper part. That is the best way to go about it to prevent the umbilical cord from getting infected. After you have applied the chlorhexidine gel, how do you place your umbilical cord? Do you put it inside the diaper or outside the diaper? If you place it inside the diaper, there are chances that when the baby passes urine or stool, the umbilical cord is going to be soiled with this excreta, and this will result into infection of the umbilical cord. In order to prevent this, that is why it is advisable to leave it outside the diaper. Take note, you leave it outside the diaper, and this will also allow it to dry faster and force faster. Again, if you realize after 10 days the umbilical cord has not fallen, because if it is getting to like 2 weeks, 3 weeks, it has not fallen, please check the umbilical cord for signs of infection. One of them, you see pus oozing out from the base of the umbilical cord. That is a sign of infection. You might see redness around the skin surrounding the umbilical cord. It is also a sign of infection, and the baby might even be having fever. If you like my video, please follow for more. Till we meet again, I remain Dr. Moye.